If 2020 was the year of the virus, then 2021 is, we hope, the year of the vaccine. And between the pandemic and the campaign to defeat its spread, there is great asymmetry. The virus is a submicroscopic scrap of nucleic acid coated with protein. Some scientists call viruses organisms at the edge of life. They're driven to reproduce, but to do so, they must invade the cells of host organisms like us. By way of contrast, a vaccine is anything but elemental. Vaccination summons the skills of civilization itself: science, industry, commerce, government, social organization, mutual trust. And that's the challenge in this year of the vaccine, to harness the efforts and talents of individuals and institutions to stamp out the spread of this contagion. Can we do it effectively and efficiently and equitably enough to save lives and deliver us from what we call here this new abnormal? Well, we'll be hearing a remarkable panel address those very questions. And our first guest, who joins us from New York, is Dr. Irwin Redlener. You wrote a book back in 2006 called Americans at Risk: Why We Are Not Prepared for Mega Disasters and What We Can Do Now. And you described the possibility in that book of a terrible avian flu pandemic. But you weren't just writing about pandemics. You're writing your experience of what happened in New Orleans after Hurricane Katrina was a big influence on you. And you would say there's something about our country that either encourages unpreparedness or at least makes us not rebel at the thought of unpreparedness for disaster. What is it?
Well, there's something about the American DNA from a sociological point of view. You know, we're pretty good, although not great, at responding to a catastrophe. Preparing for and preventing is not our strong suit. Let me put it that way. We have some inherent problem in getting our arms wrapped around what you have to do to prevent future calamities, even though we know they're coming. You know, the climate change and global warming is a tremendous disaster. We see it's right in front of us. The train wreck is about to happen, and we can't get our arms around it. And I think the same goes. Yeah, it was like, 14 years ago or so that book came out, and I laid out a scenario for how the pandemic would unfold. There was discussions about how to deal with this back earlier in the 2000s, but and I wasn't the only one. Plenty of people were worried about that, and it's just that we just didn't do anything about it. And then it got here, and we're incredibly not prepared.
Joe Biden says he wants to immunize 100 million people in his first 100 days. Do we have the supply required and a public health system prepared to accomplish this? Peter Hotez, why don't you start?
And first of all, I think it's really important he set that ambitious goal. One of the things that we haven't done is we stopped being a country that's willing to do hard things, and we have to be willing to do hard things. This is all we have left. So we're going to do it. We have no other choice. It's going to be daunting. We don't have the infrastructure yet to vaccinate the American people at that scale. We've got to streamline some of the guidelines, and we have to get more vaccines up. So if you ask me today, do we have it all in place? Absolutely not. But this is going to have to be the number one priority for the administration, and really the number one priority for every elected leader. And I've now calling on every public official, every elected leader across the country to be able to articulate what they're doing to vaccinate the American people, because otherwise the default is unimaginable. We're looking at 400,000 Americans who will lose their lives by the inauguration, which is the number of Americans who sacrificed their lives in World War II. We'll be looking at 500,000 in March. We'll be looking at 640,000 Americans who lose their lives by May, which is equivalent to the number of people who lost their lives in the United States during the 1918 flu pandemic. So we're talking about something of that magnitude, and this has to be their priority. I actually have some optimism we'll do it, but there's going to be growing pains.
Does the vaccine prevent outright infection of coronavirus or reduce the severity of the infection, or does it do both? I guess we're talking about the two messenger RNA vaccines, Moderna and Pfizer, that are in the U.S.
If you don't mind, I'll just jump in and say that there's some real kind of maybe breaking news on this front from Israel. Just yesterday, the Ministry of Health came out on the basis of data from one of the largest HMO, from the Clalit HMO, which is beginning to show not only a decrease in disease from the vaccine, but actually a decrease in transmissibility. And so, and this is based on quite a large amount of data that's been gathered. It's one of the reasons that Pfizer's been so eager to provide Israel with enough vaccine, is that Israel's been willing to provide Pfizer back with data on the population.
Why is there a supply backlog? If Moderna does not require such cold storage, or quite such cold storage as Pfizer, why don't we prioritize Moderna over Pfizer? She says we are both over 65 years old and we cannot get an appointment until June of 2021.
Well, listen, all of this, again, context. If you look at vaccines across world history, they typically took 10 to 20 years from conception to getting them into people at any scale. This has now been done in months. So this is a historic milestone, but it's both production, scaling. Just because you have a vaccine that's safe and effective that you can make in thousands or tens of thousands of doses, it's not the same thing to have to produce millions or billions of doses. So that's really a scaling question. And then once you have the product, it has to get to certain locations that have the right kind of freezer systems. Pfizer -80, those are expensive freezer systems. I know because I run a research lab, I got to pay for them. And those usually just found in biomedical centers, or the Moderna product at -20, which is more like the temperature in your household freezer. And then beyond that, it has to get into people's arms. So there are challenges at every one of those steps. I'm not privy to all the day-to-day information of how many vials are where right now. The bottom line is I would take whatever vaccine you qualify for. Both the Pfizer and Moderna products are safe, effective. They look to be similar in those characteristics, and whatever is available. And I know that those sponsors, those companies are trying to produce as quickly as they can, but the challenge remains to do this all so quickly at such a large scale.
Professor Schwartz, you're on the committee that advises the governor of Connecticut. As you say, different states are doing things differently. Do you get the sense that things are better, that there's some feedback mechanism here when things go wrong, that at least in Connecticut, they take on board the problems and do something better?
States are learning. We're now, 5 weeks into this vaccination program. Clearly, the performance is variable across states. Connecticut, I'm proud to say, is doing quite well in the rankings, if we want to think of it that way. But that's a reminder that we're just getting underway and that there's very hard work still to be done. We're now moving from what might be the easiest stage of the vaccination rollout, focusing on our healthcare workers and our long-term care facilities, to now this phase 1B, which is ever expanding, as we've heard about, which reaches a much more large and scattered population of older individuals, high-risk individuals in states like Connecticut that are identified based on their essential work they perform. So the challenges are now cascading. We're reaching a new chapter where we need to now think about rapid expansion of not just the vaccination infrastructure, but the communications, the outreach, the engagement with communities to help them identify where and when and how they can get a vaccine. So there's a lot of learning happening. I think there will be changes afoot with the arrival of the Biden administration, and it's not a moment too soon, because clearly we are in a situation where these vaccines are urgently needed. The pandemic is raging, and there's difficult times ahead, but the vaccine does provide a reason for hope, despite all of these challenges we're encountering right now with them.
Well, Dr. Ofer Levy and Professor Jason Schwartz, Dr. Peter Hotez, Dr. Irwin Redlener, and Michael Drescher, thanks to all of you for taking part in this discussion about what we hope will be at least as much the year of the vaccine as the year of the virus in 2021. Thanks to all of you. And many thanks to Joshua Plout and Nate Bonzani and Ronnie Giuliano, all of the American Friends of Rabin Medical Center, and our video and Zoom director, Bobby Grandone. Also thanks to our sponsor, which is the American Friends of Rabin Medical Center. It's a 501c3 national charitable organization representing, in the United States, Israel's largest hospital, Rabin Medical Center, in Petach Tikva in Greater Tel Aviv. The website, by the way, for the hospital is www.afrmc.org. Join us next month for Addressing Racial Inequality. panel with special guests. I'm Robert Siegel, and this has been Global Connections, Navigating the New Abnormal. See you next month. Stay safe and stay healthy.